In the summer of 2012, Erlanger was one of the hospitals chosen by NICHQ to be a part of the Best Fed Beginnings project. And at that time, our hospital set a goal to be ready to have our baby-friendly site visit by this September 2014. And I'm really proud to say that we have met our goal and we have our site visit scheduled.
I've worked with mothers and babies for 28 years and primary lactation for 15 years. And over the last 2 years of this project, we have really noticed a lot of changes that have happened. Number one, that our supplementation rate has gone from 62% to 28% last month. Also, a lot of our mothers' milk volume has really increased before they leave the hospital at 2 days. So once they go home from the hospital, they're not having as many issues.
We are very excited about the Skin to Skin with our moms and babies. It has increased our patient satisfaction. Mothers love having the babies placed on their chest immediately after delivery. We cannot imagine going back to the way we used to do this, which was taking the baby to the nursery, being separated from mom for a couple of hours. So this is an excellent program and we're very excited about it.
I moved to Chattanooga a year ago from an outlying facility. There, the baby was immediately taken to the nursery, the vitals were done, the bath was given, and the pediatrician did the initial assessment, which took a couple hours. Then I moved here, and Skin to Skin was already implemented and doing wonderful things. It was helping the baby to stabilize temperature, blood sugar, and helping the baby breastfeed sooner. And I cannot believe the difference it's made. It's just been an amazing experience, and I'm so glad I got to be part of it.
This is my sixth C-section, and I always wanted to have a natural delivery, but it just never worked out. So I just thought that all those thoughts of, wanting to see them right after birth and all that was just lost. And because, that as soon as they're born, they take them away to the nursery. And my other 5 were born at a different hospital. It was a different experience where I was in recovery asking for the baby, and it was probably an hour later before they brought the baby in to me. I'd even seen pictures of the baby on my mom's camera before I actually saw the baby. So this time, whenever she was born, my husband held her, and he held her, the whole time through surgery, and then I got to see her being weighed, and then in the recovery room, they brought her right to me with skin-to-skin contact and all that. And she still had the newborn baby stuff on her where she hadn't bathed yet. And I'd never seen anything like that, or her umbilical cord. And it was just a great experience to do all that. And then whenever we finally got in here, they bathed her in the room. And she never left my sight until we were, talking about leaving. And then they took her to the nursery for maybe 30 minutes to do PKU. And that's the only time she's been out of my sight.
One of the most innovative things that we did as a result of this project was the scripting for our staff. We had scripting on breastfeeding, rooming in, skin to skin, the use of pacifiers. All 120 employees had copies of those scripts and memorized them so that all of our patients would get the same concise messages. Another innovation that we did was the creation of a breastfeeding room for all of the employees of the facility. Prior to this project, we did not have such a room. We just had the back of the circumcision room for our own employees, but we now have a private 3-station room which receives about 100 visits a month.
Our mother partner, Beth, has been a great asset to our team. She had both of her children here at Erlanger. She is in tune with social media and online learning. She helped us to realize the value of offering online education to our moms, our patients, and the community at large.
We just want to take this time to highlight our management team. We could not have done all of this without them, from our chief nursing executive to our physician liaisons, and we just are very excited for this opportunity to become a baby-friendly hospital.